Are there specific risk factors for early psychosis? Imagine catching a small crack in a window before it turns into a big break. Recognizing early signs of psychosis can be just as important. Early intervention research is all about finding those cracks early on. When it comes to early psychosis, which is the first phase when symptoms like hallucinations or strange thoughts start to show, certain factors can make someone more vulnerable. Knowing these risk factors helps doctors and families act quickly to prevent the situation from worsening. One major factor is genetics. If someone in your family has had schizophrenia or related mental health issues, your chances of developing early psychosis are higher. Studies show that about 80% of the risk can be linked to genes. But it's not just about genes alone. Environmental factors also play a big role. For example, problems during pregnancy like poor nutrition, infections, or exposure to toxins can influence brain development. Babies born with low weight or who faced prenatal stress are more likely to develop psychosis later. Early life experiences matter too. Childhood trauma, emotional neglect, or losing a loved one can increase the risk. These stressful events can change how brain circuits work, especially those involved in thinking and sensing the world. Substance use is another important factor. Using drugs like cannabis, especially high-potency types, during adolescence or young adulthood can double the chance of developing psychosis if someone is already vulnerable. Other drugs like cocaine or LSD can also trigger symptoms or make existing issues worse. Stressful life events in adulthood, such as losing a job or experiencing social isolation, can also bring on early psychosis. Chronic stress affects brain chemistry and can push someone over the edge if they are already at risk. Brain development abnormalities are linked to early psychosis as well. Differences in neurotransmitter systems like dopamine and glutamate, which help regulate mood and perception, have been observed in people who develop schizophrenia. Brain scans often show structural differences in these individuals. Age and sex influence risk too. Most cases of early psychosis happen between ages 16 and 30. Men tend to develop symptoms earlier than women, possibly because of hormonal differences like the protective effect of estrogen in females. Understanding these risk factors is key for early intervention programs. When someone shows early signs or has known risks, health professionals can monitor and support them. This might include therapy, education, or medication to help delay or lessen the severity of psychosis. The goal is to catch these signs early and provide help before full-blown schizophrenia develops. In the end, early psychosis results from a mix of genetic, environmental, developmental, and social factors. Recognizing these helps researchers and clinicians develop better ways to prevent or treat the condition early on.